Right, okay.
Mm-hmm.
Thank you very much, everyone, and welcome to today. I understand there are no apologies, and I want to thank everyone for allowing me to push back the start time to 12 to allow me to attend a Public Health Scotland meeting in advance of this. And our safety net position is if we haven't got through the agenda by the time we need to break in advance of the IJB proper, then we can adjourn the meeting and pick it up after the IJB meeting. And I hope is everyone okay with that? I appreciate that might be quite a challenge for some, but it might give us some sharpened focus in terms of working our way through this quite significant agenda. And I don't want us to rush it at all, but taken that very fine line there. So thank you very much. Do we have any declarations of interest? Just my standing one, Karen, in that I'm a non-executive director of Public Health Scotland as a COSLA representative, and I have a specific exclusion for that. Okay, so if we can go to the item 3 on the agenda, which is the minutes of the previous meeting. Can we have a look at that and see if everyone's okay with it? Or on your combined paper, everyone okay? I'll accept silence as approval. Page 5, page 6, page 7, going on to page 8 and page 9. So if there are no corrections, or approve that paper, please. Yes, happy with that. That's excellent. Thank you very much. And then moving on to item 3B, which is the action points update. Does anyone want to talk us through any of that, or are there any questions for it? Sandy.
Yeah, thanks, Chair, and good afternoon, everybody. Yeah, hopefully you'll be able to see that a number of the more recent actions are now kind of going green or moving on a wee bit, so that is helpful. The second page of actions does have, as you perhaps expect, the longest standing actions that haven't been resolved. There are a number of things that we are actually managing to make a bit of a movement on. I'm having ongoing conversations with Angus Council regarding professional line management responsibility. Those discussions are taking perhaps fractionally longer than I might hope, but we are having those, so they are moving on. There's an item also from June 2020 about training for managers in the partnership, and only this month myself, Sheila McGrady and Jane Mark, who are both, I think, on the call, have had conversations about how we would put something together regarding that. We know there's induction work on the go at the moment, so that's an action outstanding back to June 2019. So members will, hopefully, many people have yet something that's on next week. So again, that might allow this action to turn green in due course. So there's progress there, although some things have been long-standing. And only the other day, the Chair and I were talking about the very final item here, which we might be able to reassess, which was about the way we train the audit committee. And some of that has been influenced by our own views or our own knowledge, in fact, about the turnover of audit committee membership. But I think we've reached a period of slightly more, I don't want to say this out loud, but we have been slightly more stable in terms of our membership. So I think we can just reassess that one amongst ourselves. So movement on the second page, Chair. I just wanted to kind of highlight that for everybody.
That's great. Thank you very much. And yes, I think the stability has settled down a wee bit. Gail, you've got your hand up there.
Yes, in addition to what Sandy said, I can confirm that the process for the Chief Officer position that was advertised and the closing date has passed. The recruitment has been handled at this stage by a company called Aspen People, who are in the process of shortlisting the long list, as far as I'm aware. So that's the situation at the moment.
Thank you very much. And I mean, to pick up on a comment that's made in a later paper. I mean, I hugely appreciate the interim arrangements and the quality of management that we've maintained throughout that entire period, while recognising it does inevitably put quite a significant pressure on people in that period. And I wanted to make sure that is acknowledged by the Audit Committee, and to thank everyone who's stepped up and stepped in during that enormously unsettling time, which has been much more extended than we would have liked. But I'm really pleased to hear that things are moving on now. So I hope the rest of the committee can endorse that view.
Thank you.
Excellent.
Thank you, Chair. That's
Thanks, Charlie.
appreciated, because
Okay.
we have been running a post short, as you're aware,
Yes.
and then the interim arrangements involve interim arrangements for others in the backfill, so it's been extremely challenging, as you're aware.
Yeah.
So thank you for acknowledging that.
Well, I think it's important to do that. Andrew, you've got your hand up.
Yeah, I'll have to leave the meeting. I'm getting as you can probably hear, I'm getting a roof done, and I won't manage the IJB as well. So if you could hand on my apologies, please.
Okay, well, you take care. Hope that
Okay.
goes well, Andrew.
No, it's not
Okay.
going too well at the moment, but it's not.
I know. Oh
Needs my
dear.
attention.
I hope you managed to stay safe and out of the way there, Andrew.
I hope I've got a roof. That's all. Thanks. So sorry about the late.
I've got a spare bedroom. You're very
Oh, well.
welcome.
Thank you very much.
We just hope it doesn't rain.
Bye for now then.
Gosh, that's real life impinging, isn't it? What a
Yeah.
shame. Thanks,
See ya.
Andrew. Take care.
Bye.
Okay, bye. Right, thank you very much. So people happy with the action plan with those additional comments there? That's great. Thank you. We can note that. And if we can move on to the next item on the agenda, sorry, item 4 is the Clinical Care and Professional Governance Annual Assurance Report, which is covered this afternoon. Okay, so we've ticked that off. People happy with that?
Yeah.
Okay, good. Okay, so item 5 then, which is the internal audit reports. And just let me get back to the page. There we go. The follow-up action. Sandy, are you introducing that for us?
Yeah, thanks, Chair. I'll maybe just comment on the last item, that the clinical governance report. The reason we've not put it on the audit committee agenda was purely to avoid duplication and confusion amongst us all. So we'll have a chance to consider that.
Yeah.
So yeah, the internal audit follow-up actions. You know, it's a standard report. I mean, it is moving on a wee bit. You know, we know some things have got a wee bit stuck, and I think I'd maybe comment on 2 things. While we see some, again, green on the first page, the second page has got a few reds against it, and some of those are against, I'm just going to use it as an example, the data quality audit from 2020. And I think, again, it's probably just worth us all, I mean, we don't need reminding of this, but sometimes maybe we do a wee bit. We've obviously had to redeploy and reprioritise a lot over the last 15 months, and 1 or 2 things such as this, which would have required quite a lot of management effort in certain parts of the partnership, we just haven't been able to get to. So we will gradually get back to these, definitely, but that's why we're seeing these things last longer than we would expect. The other point to note is on the first page, you're just kind of keeping an eye on things. There's the item about the risk policy and progressing things associated with that, and we have got some development work to be doing on our risk appetite. So we know that that's kind of in the offing. So again, things are moving, but we just need to keep on our mind as we see these things over the coming months, that some of the reds are due to the way we've redeployed over the last 15 months.
Okay, for some of those red areas where resourcing is an issue, have we reached a stage where that resource is being freed up to progress things, or is there additional resource that still needs to be identified? Or, you know, I'm not thinking necessarily money, but people and skills.
Sure. I mean, people, if you think about some of these tasks being taken forward by people in the wider definition of the management team, what we're finding is, as some of our COVID work the day-to-day COVID stuff kind of comes off the kind of maximum impact, it does release a bit of our time, and some of it will be about us trying to re-normalise, hopefully in the context of more post-COVID. So things like some of our improvement and development teams will gradually be able to get back to doing some of the improvement work. So I think we're gradually seeing that kind of fall back into place. There's obviously an enormous backlog, so it's not just things that are read on this page. There's lots of other things all backed up, things that are behind the scenes and whatever. But for some of these things, we are, and we've said this through some of our strategic financial plans, we are trying to insert some more overall management resource into our system, because we were already creaking a wee bit anyway pre-COVID. So yes, it'll hopefully increasingly we'll be able to deal with these things, Chair, and we've got some extra resource going in there on to support the overall management structure as well.
Okay, that's comforting. Tony?
Sorry, Chair, my mouse was playing up. Very swiftly, the last one on page 19, item number 6, I'd suggest that's really been superseded, and I don't want to give away the excitement of the annual report that's coming up later, but I think that last one will be superseded by the recommendations in that report. So you don't want to keep, that one might as well just kind of disappear and be replaced by the other two when we come along.
Okay, we'll cover that when we get to that paper.
Well, the reason I'm mentioning it now is I think you might formally need to decide that as a committee.
Okay.
To the next one, but I just wanted to highlight that.
Okay then, thank you very much. Did I have that circled on my own papers? Okay, so are we happy to note this report and the progress made today, and acknowledging Sandy's additional commentary on it? Everyone happy to do that? Yes, yeah. I'm seeing nods. That's marvellous. Thank you very much. And oh, something awful's happened to my papers. Hang on. Don't know what went wrong there. Right. Thank you. Right. So agenda item 6, which is the governance action plans. And again, a commentary from Sandy to introduce this, please.
Okay, and I think this is where Tony was picking up an item for comment. So it's a regular report. Some of these actions are a bit more stuck than on the paper before. That reflects the complexity and a variety of other factors that we've talked about. We know that, again, with regard to our COVID response over the last 15 months, we have had to reprioritise. It says that in the covering paper, and that has meant some of the governance improvement actions haven't happened. Although, I think we'll see later on that we have managed to at least retain our governance structure, but we haven't managed to do the improvement actions, which is what this is more about. So I don't have any particular comments to make on this one, Chair. It is an area where we will plug away at things. One or two things will gradually get superseded, and I have a feeling that's what Tony was kind of referring to. So we can keep that in mind. But again, things backed up because of COVID, and also the underlying complexity of one or two things here.
Sure. Okay. So anyone else want to come in on that at all? As referring back to Tony's points, if we feel that those last two actions could be taken off. To be honest, Tony, can I just get clarity on item 6? IJB is still working towards ensuring that SPG considers status of strategic plan. Has that now been covered off? Can anyone give me comfort on that?
It's more the case that we've produced newer recommendations in much more detail.
That's
so we've
fine.
gone from, we suggest you monitor that and have a think about it, to very, very specific detailed recommendations on the hows and whys. So it's not as if it's been done, it's more that we've replaced it with more detailed recommendations.
More detail.
As the urgency has increased. That's
fine. I think we can take that on board. Is the committee happy to do that? I do appreciate looking at that page can be quite concerning with the amount of red on it, but I think the background is really helpful to help us understand that. So thanks, Sandy, for that. Everyone okay with that approach? Having more detailed actions on the back of that? Yes? I'm seeing nods. It's quite disconcerting when you're trying to read the paper and see the responses as well. Okay, so we can note the action plan and any outstanding actions reported to the Audit Committee in future versions of this report. Thank you very much. Item 7, Internal Audit Report, Governance and Assurance. And we're being asked to note the Internal Audit Review of Governance and Assurance. Sandy?
Yeah, thanks, Chair. So this report updates the members on some work that's been undertaken by our internal audit team as part of the annual internal audit plan. A lot of this work was undertaken earlier on this financial year when we were more in the midst of COVID, and as a management team, we were starting to get some of that feedback a while ago. But this kind of summarises it in terms of in terms of letting the audit committee know. I mean, I think generally, the auditors, and Tony can maybe chip in, feels that we were able to keep on top of our governance arrangements as best as could be reasonably expected. And I think in the context of the overall response to COVID, I think that feels like quite a good place for us to have kind of come out at. So hopefully this kind of gives people the kind of reassurance in terms of the governance arrangements kind of standing up and being robust enough, as part of our overall COVID response.
Okay. Tony, do you want to come in on that?
If I can, Joe, I mean, I think the main thing to say is this was a moment in time. That time's kind of been and gone. With limited time, I might suggest that we probably focus more on the annual report, which contains that and what's happened since. So it was done for a specific purpose at a moment in time. In the circumstances, I think it's a very positive report, but its time has been and gone, really. I think that if we're going to devote our time, probably looking forward in the annual report's more helpful.
Okay, that's great. I endorse that approach. Is everyone else happy with that as well? So we note the content of this report. Yeah.
Can I
Excellent.
add something, Chair?
Oh, sorry.
I don't know if my hand's working.
Oh, it is
yes,
actually. It was tiny.
I'm very encouraged when Tony uses the words overall positive impression. That's certainly music to my ears. In relation to 2.5, I can say though that the NHS Tayside Chief Executive, the 3 partnership chief officers and the 3 chief executives from the local authorities have all been meeting regarding the integration scheme, and Vivian Davidson, who's been seconded 2 days a week to develop this, has met with us. And I know that she had a meeting with the Chief Exec of NHS Tayside last week to try and identify an individual to support her with that. But the partnerships and the local authorities have established a working group, Tony, and that's certainly progressing at the moment.
Okay.
Indeed, Joan, if I may, some Bright Spark, I'm not sure Vivian will be grateful for this, but some Bright Spark had the idea of asking me to get involved as well, so they all get the benefit of my detailed analysis.
Excellent, excellent.
Whether that speeds up the process or not, but certainly there will be internal audit input, so we can make sure all the points we've been raising over the years here and elsewhere are brought in, and we've already had a discussion with Vivian about where and how we might best add value in that process.
Good. And will that also wrap up 2.6 there, provider support?
Some of it, again, a lot of these we've covered in the annual report because we've tried to be helpful and have some ideas. The corporate support's a big one. We are doing a piece of work for another IJB on that, but you'll see from the annual report later, I actually think there's some benefit in the IJBs getting together, be it formally or informally, just because of the time pressures. Everyone's so busy. Having 3 people reinventing the wheel doesn't seem particularly helpful, and to a large extent, okay, you deal with your councils as well, but you're all dealing with one body, which is NHS Tayside. So having singing from the same hymn sheet, not redoing the work, feels like a sensible thing to do, and we've recommended that. So I think between that and what's in the annual report, it will get covered off, and hopefully we'll finally get some movement. And we even had a bright idea about large hospitals set aside, but we'll get to that later.
I did notice that, and I did also notice your word of the week, which is intractable.
Oh,
I saw that. Yeah.
Yes, that got picked up at the Dundee, because we had the Dundee IJB board meeting this morning, and that word got picked up as well. So yeah, I did manage to wangle quotidian into an audit report once, but no one picked up on it. So there you go. But intractable has got some traction.
Excellent. That's what we like to hear. Thank you, Tony. Okay, so we're all happy to note this report and thank Tony for the feedback there. Thank you. Okay, so item 8, we're on the 2021 and 21-22 internal audit plans progress report, and that's over to Tony, please.
So moving things on swiftly, we've kind of done what we said we were going to do, and that's it. That's the plan there now. And you know, I
liked all the ticks.
Yep, ticks. Basically, that's the word of the. Intractable was the word of the previous report. Ticks are the word for this report, and I shall say no more.
Excellent. Does anyone have any questions for Tony on that? I thought it was a very positive report. Yeah, very happy with that. Gail, your hand's up, yeah? Gail, you're on mute. Sorry.
Sorry, I thought it clicked off. Yes, I like all the ticks too, but thank you, Tony. I was one of the colleagues, as Tony's aware, that gets frustrated with the gap between significant and merits attention. Causes me a bit of frustration. So thank you for doing that, Tony. It was noted.
Okay, so thanks very much, Tony. We're happy to note that report. Item 9. It's the Angus Annual Risk Management Report 2021, and I think that's over to Gail. Who seems to have disappeared, has she?
No, I'm here.
Oh, you're here. You're back now.
Yeah, my camera's not wanting to go off here. Yes, the report's pretty self-explanatory, Chair. The Angus IJB approved the risk management strategy, and we're in a process of monitoring this, as you're all aware, within our agreed methodologies. Our risks are pretty straightforward. We attended the recent NHS Tayside Risk Management Committee, and they were extremely supportive of our risks and recognised our risks. And we had 2 new risks, and both were actioned that afternoon, including the one around workforce and the support from workforce with regard to Brechin. So that was actioned by our Director of Workforce in the afternoon. Regarding the risk appetite, I've been in touch with Tony. We've got a meeting next week, I think it's Tony, 1st of July, regarding the risk appetite session, which should be on the next audit committee date, Chair, in August.
Okay, thank you. I just wondered, I mean, I would expect, obviously, exception reporting on anything that came up, and I don't want to create an industry out of this, but I just wondered if there was an opportunity to have a short discussion around, is an annual report enough, or would something in between be worth considering? I don't want to give officers too much work when they're trying to actually manage the risks.
I could probably do a midway report, if that's acceptable, not in the detail of the annual report, maybe a summary sheet of what our risks are and a summary of where we are with our reporting, if that's acceptable.
That certainly seems reasonable if you think that is manageable within capacity.
Yeah, I'll just do a briefing on the risks and exceptions. Yep. Okay. Tony?
Yeah, just to say, we'll pick it up next week, Carl, but there are a number of IJBs are going to wrestle with how you do, because there's some very good reports, like Lanarkshire, for example, there's some really good reporting for the health board on risks, but they've got a massive range of operational risks when you've got a limited number of strategic risks. But I've been doing work with other IJB, mainly focused around saying what are the big changes and are we updating things, and how, for example, we updated for COVID, etc. So I think there's some very limited reporting that could be done biannually, which would just kind of give the audit committee, which is kind of essentially an audit and risk committee, the opportunity to see where the movements have been, and just to make sure that the system, because your primary responsibility as an audit committee is that the system of risk management is being maintained, which we know it is, and some very good work done in Angus. So it's probably just how you do that in a way that doesn't drown the committee in unnecessary detail. But I think we've seen some stuff elsewhere that might be helpful, so I'll share that with Gail next week.
Okay, that's brilliant, Tony. Thank you very much. Gail, you want to come back in?
Yeah, Tony, would you want to see? I could prepare a draft. I don't know if you would want to see that before. Would that be helpful?
Yeah, that'd be great. Yeah, and again, I mean, it's all about sharing. So there's some interesting work. South Lanarkshire IJB in particular has done some good stuff, but they're open to suggestions as well. Everyone's wrestling with the same stuff, and IJBs are different beasts. So you can't just pull what the council does or the health board does or whatever. You need to come up with your own solutions. But IJBs tend, to be facing their own issues. So I think the more we can share, the better. And I'll share what Martin's done in South Lanarkshire, and I'll plagiarise your work with pride as well.
Good show. Sandy.
Yeah, thanks, Chair. So we're just for the minute, we're going to confirm that we will look to get an interim mid-year report, summarised report to the December Audit Committee.
Excellent. Thank you. Thank
Yeah.
you.
Yeah.
So going back to the recommendations, we note the report, and that's the specific further action that we've identified today. Thank you. Excellent. Okay. Right, so that's us on to item 10, which is the internal audit report. Who's going to take us through that?
Would you, Chair, I could maybe just introduce it, and I'll pass it to Tony in a second. So you'll be familiar with this, for those of you who've been around the block a couple of times. Chris, honestly, I can't remember now when you joined, but I have a feeling it was maybe this time last year. I can't remember now, but
no, this is my first, Sandy.
Your first one is okay. So just for Chris's benefit, for all as a reminder, at the end of every financial year, every cycle, our internal auditors, as it probably says in the covering paper, do quite a thorough review of our overall governance arrangements. We I think completed maybe something like a 40-page document, kind of setting out where we are in a whole series of domains from things like strategic planning, financial governance, information governance, staff, lots of different domains, and we filled that all in and shared that with our internal auditors. They've obviously reviewed all our feedback and collated this report. This report then helps us inform our annual governance statement, which appears later on the agenda, and is also shared with our external auditors as they do their reviews. We've obviously captured some of the summary comments in the covering paper, but partly to do with timing, but also to do, it's quite an in-depth report. We normally try and put quite complete management responses in there. We haven't done that this year. We've only put preliminary responses that people would be able to tell when you get to those responses. And the idea is that the management team will look at things in a bit more detail over the summer and come back probably to the audit committee, I think, to come back to the audit committee and our internal auditors to say this is our more detailed, a more considered view about some of the recommendations in here. So we're trying not to rush things, get everybody kind of involved and sighted on things, and get feedback and more comprehensive set of replies in August.
That seems reasonable. Tony, would you like to come in now?
Thank you, Chair. I think one thing I'm going to say as part of that process of revision, it does get quite condensed at year end. And there's a paragraph I've been intending to add, and I'm certainly not going to be reading out all of this report. I would like to read out the paragraph that I would intend to add. So the IJB has performed well in difficult circumstances. It's facing long-standing structural governance issues, which can only be resolved in partnership with other bodies, as well as the unprecedented challenges created by COVID. And in particular, COVID-19 has meant the strategic commissioning plan, whilst not technically out of date, no longer reflects the environment in which the IJB operates. And therefore, while this report contains a number of important recommendations, this is simply a reflection of the massive changes to the risk profile in which the IJB operates, as well as the complex intertwined governance landscape the IJB must navigate. That's quite a long and complex paragraph. I could actually share the screen, I suppose, but you get the message. And there's a phrase I use, it's an audit report, not a school report. So just because there are things there that we say are important issues that need to be addressed, it doesn't mean the IJB has done badly. And the analogy I always use is that of the flood barrier. And there was a sense in which we had 8 foot high flood walls. And for years, our waters were at 5 foot, say, which meant that we could cope with the variation and it was fine. Already pre-COVID, just the landscape, the if you like, global warming was pushing those waters higher. And then we got hit by a tsunami, which is COVID. So this report isn't saying that the IJB hasn't done well. It's done exceptionally well in extraordinarily difficult circumstances. It's just saying this is what we're left with. And the difficulty, and I'll go through a little bit of the detail, but the overarching thing is just COVID has created massive changes to the way we can deliver our services, to service need. It highlighted issues of equity, which we all kind of knew, but weren't really at the forefront before and need to be. All of that means that our strategic planning needs to be different, our prioritisation needs to change, and there will be difficult choices to be made, and those choices will be hard to get through. They'll be hard to navigate, they'll be hard to bring the public and possibly the Scottish Government with us, but they need to be done. Because we can either try and do everything and fail, or we can prioritise and succeed. And the important thing for you as members is being part of that process. So that's the whole ethos behind the report. There's a lot of detail there, but that's the fundamentals of it. So, having said all that, and the other thing I wouldn't want to sign it because it came up elsewhere. You can look at our reports and you will find a lot of recommendations and a lot of detail. And you might look at another IJB report done by a different auditor and find a lot less detail. That doesn't mean, and definitely doesn't mean, because I know from experience, that your situation is worse than theirs. It just means that different auditors report things in different places and in different ways. And unfortunately, if you've got someone that reports in fairly minute detail, because we want to give it a picture and we want to add value. So you can't just go around and look at another IJB and say they must be better just because their audit report's shorter and there's fewer recommendations. So having said that, I would hope the report's self-explanatory. There's a lot of focus on the strategic planning, which you'll not be surprised at given what I just said. Key messages: your governance continued in difficult circumstances, which reiterates what was said earlier. You've actually done some good work with all the MSG. I know, and sometimes I joke about Sandy kind of focusing on the bad. I think Sandy's a frustrated auditor because he goes straight to the negative. But you've actually achieved an awful lot, and that should be celebrated, particularly in the circumstances. Obviously, there's more to do. A lot of that, as we've said, boils down to the fact that you can't do it on your own. The difficulty is that you will have a lot of officers who've been working extraordinarily hard and in Angus because of the management situation. You know, everyone's been difficult. Trying to deal with COVID and do all the other stuff is bad enough. When you're doing it with a few people short, and as we know, the corporate support hasn't been what you would have wanted and needed, it does make it hard. In those circumstances, I think it's an excellent performance. What we're left with is what needs done. that will require prioritisation. You'll tell from the report that our obvious view is that the strategic plan is the most important thing. I mean, obviously you need to deal with the exigencies of COVID now, but as a board, you need to make sure that these things are happening, that we are getting ready to engage with the public on some difficult choices, that the planning process involves you as board members in those difficult choices, that you as board members understand where, when and how you're going to be engaged with. And we talk about parameters and processes, and we got kind of slightly alliteration crazy with the B's, but what that boils down to is you will be making hard choices. You need as a board to say, well, okay, here are some things that are sacrosanct so people don't go off and work up proposals that just will never fly. But you also need to be clearly involved in saying, this is how we're going to decide what we do and what we don't. Because when the decisions, when they do come, could well be unpalatable. And you need to have a set of rules that allows officers to go off and do that work and indeed engage with the public to see their views. So it's a complex process. It's one that we've gone into quite a bit of detail. Apart from that, which is one of the key features, I would say that there's a lot of positives. The risk management, which has been a long-standing issue, we've now got that new strategy, and I think it's an excellent strategy. In the clinical and care governance front, the work that's been done by Alison in terms of producing those clinical and care governance reports, I think it's excellent. Really is, it's top quality stuff. And again, as I always do, if something's in public, I will share that with my colleagues from other IJBs and say, look at that, that's a good piece of work. That's the sort of thing you can learn from. So there is some real positives there in extraordinarily difficult circumstances. And what we end up with, and I won't take you through the report because I'm very conscious of the time. If we come to the recommendations, the first one, obviously the strategic plan, as indeed, the first one's the strategic plan. The second one uses the word intractable again. And what we're really saying there is, and then it's building on success. I mean, auditing is not a difficult job. You look at what's worked and you go, well, do more of that. And you look at what hasn't worked and go, well, either do less of that or change it. And in the case of the risk management, that was, I think, not without challenges because it's always difficult when you're working with different groups of people. But that produced something really positive. So probably more of that. And what we are saying with large hospitals set aside is maybe you can't avoid the national guidance, which to be blunt, has been in place for a lot of years. Hasn't really worked anywhere as far as I'm concerned. Lanarkshire did some interesting work, but the amount of effort required was extraordinary and it didn't take anyone that much further forward. If you're going to focus your attention when you're doing the strategic plans, it's about, again, working with the other IJBs to say what strategic changes would make a big enough difference that the health board can shut things and free up resources to shift the balance of care. Now, there will be technicalities about that and about recognising past performance. We're not saying that you ignore the guidance, but strategically that seems to be the way forward. And with some of these other things, if you can work together, avoid reinventing the wheel and use your limited resources wisely, that might get us past some of these things which have frankly been hanging around for a while. After that, we're then into the just saying we still need to work on the assurances, and that's something where the assurance principles we developed we feel could be quite helpful. And the performance reporting, which I think links to our conception of using performance to show how risks are being mitigated, and particularly link into the strategic plan. So I think that's really all that I'd want to get into. The whistleblowing one, quite frankly, it's there because we spotted it, but it's not something that would if you're going to focus on anything from the report, it wouldn't be the whistleblowing. So that's a whistle stop, not whistleblowing to it. Well, I didn't plan that joke in advance, but yeah. So basically that's the report. Happy to take any questions, and hopefully I've given you what we think are the important aspects of that. Going back to the point that this is saying that the IJB did very well, but there's still a lot of challenges left, as you well know.
Thank you, Tony. I'm aware that Margot Williamson's been working on the whistleblowing policy, looking at both sides of that from my other role. And I think I would hope that this audit committee is very open to taking on board those recommendations, because I think we've reached a level of maturity that understands the process and accepts, you know, the learning. And I think we've got a very open and honest relationship around the table where we get early warning on any concerns, and people aren't prickly or oversensitive around questions being asked, which I think is very healthy. Peter, you've got your hands up.
Yeah, thanks, Chair. Tony, bring you back to section 1 of the report, page 51. Your comment on point 17 about the previous statements from the other two partners. I wondered what issues you were alluding to there.
Lord. The IJBs, well, they should come to this audit committee, I think, before you sign off the governance statement. And I'll be absolutely honest with you, they might have been of interest, but they weren't interesting enough to have stuck in my head. I honestly can't tell you, but they will be shared. There was nothing of, I mean, Tayside's governance statement used to be very interesting, almost like the Chinese curse. It's now slightly duller, but perhaps more comforting. So yeah, there are bits there. Well, because I mean, you know, what happens? You are commissioning services from bodies, and their difficulties become your difficulties. But if I'm absolutely honest, I can't remember what those were. I did look at the time, but there was nothing there that stuck in my ancient head, I'm afraid. But you will, I think, Sandy, be getting those later on, so you can tell me later on whether you think they were interesting or not, and whether I should have remembered them.
Right.
I guess the main thing that I'm kind of watching out for is the progress on the mental health strategy. That remains a concern for me. But Gail's got her hand up now.
Wasn't about mental health, Chair, sorry. Tony, I found the report really helpful, and I recognise the report, which is always a good sign. Not surprising, it's around the action points, section 2. Tony wouldn't expect me to not challenge this, and I do see it like a school report, and I know I shouldn't, Tony. But I think sometimes it's quite harsh. I know you've got to be harsh, and it's about making improvements, but I did think particularly reference 3, I just thought, gosh, after all the really good work that they've put in throughout COVID, you know, include Alison Clement, Charlie Sinclair, and the senior managers in the team, they have done exceptionally well this year. And I just thought, if they look at that significant rather than moderate, will they take the positive out? So it's extremely beneficial that we have a paragraph that says how well they've done there, because I do think people will look at the grades, Tony.
Yeah, I mean, there is, I mean, you can always argue the grades. I mean, I'm not going to pretend there's any science to these things at all. I did deal with some people once that kind of had, if you had so many significance and so many, it just got weird. I mean, it's not the way it works. It's what you call kind of false assurance if you pretend there's any maths behind this. It is judgment. So there's two things to say. What we're talking about is what you're left with at the end. So it's not like, well, you haven't done a lot of really good work. It's about what we're left with, and particularly in the current circumstances. That one's slightly different. It's about this utterly bizarre situation that you find yourself in because of the way that IJBs are structured. And mental health might be a really interesting example of that, actually. Yeah. You are responsible for commissioning those services. You're responsible for the welfare of those people. And yeah, it's in the hands of another body. And just as an aside, I've actually been doing some work for NHS Tayside on that particular risk and how that gets assured. And if I think about it, I'm not sure I mentioned to them, although it was Total particularly, but how that flows through. But there are assurance reports that are available on that risk. And there's a very interesting question. It probably goes back to this hosted services issue as well, about how that flows through and how you get these assurances. And it's something, again, when we talk about risk appetite and the future of the risk register, it's about development. I'll be honest, if that grading is in the hinterland, I am not married to that grade. I mean, if you were to challenge that and say, well, could you change it if the audit committee felt that way? And we are coming back to the report, it's not going to cause me any sleepless nights. If you talk about the strategic planning one and say that's not important, then we'd have a different discussion. But that one, yeah, fine. As long as it gets, to be honest,
no, I'm not disagreeing with the others, Tony. I just felt this particular one, because I know the efforts that have absolutely gone into that.
Yeah, no, that's fine. And it is, I will be honest with you, if I feel absolutely determined on something, I'll say on that one, yeah. And it could reflect the fact that I'm an auditor, I get slightly obsessive about assurances, so fine. I'm quite happy to reconsider that grade bluntly, with all these things, as long as it gets done. You know, that's the main thing.
I'm certainly open. I would be open to that. I find I found this grading system slightly more sensitive than a straightforward red, amber, green, but it's still a bit of a blunt tool, but is a good, I think, a starting point. Gail, so what would you like to see that move to? The
I think it should be moderate.
Moderate.
And the reason I agree to the moderate is exactly what you and Tony are saying, Chair, around the mental health and the hosted services. But actually, when you read the action point, that isn't what it says. So I would be happy if we added a line in there, Tony, around the hosted things. You know, we could look at that. But yeah, I think it should be moderate.
Yeah, and it's not, to be clear, it's not just hosted services. I mean, workforce was a good example.
Yeah,
when you have a workforce risk, how do you get assurance on that? Do the people that provide the service on your behalf actually get assurance on that?
Yeah, I'm not proposing to take anything out. It's actually on our EMT agenda anyway, Tony, the update. So yeah.
Okay.
Excellent.
Good. That sounds good. So we've got Charlie and then Catherine.
Thank you, Chair. Just to put your supportive comments, Gail, but absolutely we know we need to improve. I suppose the challenge just now, and that's maybe what Gail is alluding to, is the fact that colleagues more than myself, that would say, that are involved in ACTIS the boat in every direction. So it's very affirming to hear the positive comments, but also we do recognise that we've not quite cracked this nut yet. So moderate, absolutely fantastic, and even if it had stayed it's significant, we'll not personalise, but I do appreciate the comments.
Thanks, Charlie. That's really good to hear. Catherine? It's disappeared off my screen.
Oh, I'm here.
Okay, good.
Thanks for the offer. I think I would just like to say to Tony that this is a really helpful, comprehensive report, and it's set out really, really clearly. It's easy as a member of the committee to see what the issues are. I also did want to just point out, again, a little like Gail, I do view these things as a little bit of a school report. And on page 58, there is specific reference to a report that I produce for the council as the Chief Social Work Officer. So I think it's on page 58 and it's point 4. And I appreciate Tony's perception here that the report does not include overall conclusions about adequacy and effectiveness of arrangements for the safety and the quality of care. But I would like to point out that it is a template that's issued by Scottish Government colleagues that we are required to produce, and that the IJB is not the intended audience for that report. So I think there's something there that suggests that from an IJB scrutiny perspective, something else might be helpful. And And I think there's probably scope to have a look at what that might involve, whether it's the Chief Social Work Officer who would write it. As someone who's not involved in the direct delivery of services is a different question. However, there's maybe something there that links to what Charlie was saying about, areas of kind of growth and further development. So it's just a point of clarity about that particular report, and its role is slightly different than an IJB functional report. But there's room for development there, I think.
So what would your views be, Catherine, on how to take forward that thinking?
So in an ideal world, the report would state that the report that's provided does meet the requirements. It's just the requirements are not what Tony thinks would be most helpful to the IJB in terms of scrutiny and governance. So from a personal point of view, that distinction might have been helpful. In terms of how to take it forward, I think there's likely to be scope around how to look at these things as the changes around adult health and social care march forward in any case. My view would be that whatever the changes are brought by the Scottish Government's review of that, and the consultation that will follow, will need to consider the professional oversight and government governance arrangements again more fully. I think there are a lot of complexities that have been alluded to here and throughout this report, that there may be structural kind of solutions put forward for that might give rise to that. In terms of our own local arrangements at the moment, perhaps it's looking again at what goes into and is considered by the clinical director at the Clinical Care Governance Group, and whether or not that report in and of itself could provide a better assurance to the IJB about those delegated functions, and whether my role as the Chief Social Officer in providing advice to the IJB on that as a member of the board is sufficient, rather than looking for that to be in the Chief Social Work Officer annual report, which, as I say, serves quite a different function.
Yeah. Okay. Tony, Tony, if Tony can come back on that, and I see your hand as well, Peter. It's okay.
Yeah. So yeah, I mean, Catherine's absolutely right, and I've got, again, we'll come back with a finalist report next time, and we'll make that. So it wasn't a criticism of the report, because I know that report is, and I've had this discussion with all sorts of, I've met virtually all your colleagues, certainly on my patch. So yeah, it's not designed to do that, and but there's a sense in which, with it coming, so it comes as a very full, very comprehensive report. So it almost looks like it's should be doing that, but it doesn't. And that was probably and I didn't present it in a particularly subtle way. What we're trying to say is it looks like it does a thing, but it doesn't do that thing. And we do need something that does do that thing. So, God, if this is being recorded, that's going to look absolutely insane. But you understand where I'm coming from, that it just gives the appearance of a document which probably gives assurance, but it doesn't actually cross that final hurdle. And Catherine's absolutely right. If we can find a way to do that, and if you're looking at the fancy phrases that we can wangle into reports, asymmetrical assurance appetite might be one of them. So, yeah, and that is a manifestation of that. So what we need as an IJB might be slightly different from what the council wishes to receive. And my job is to say, well, as an IJB, what you essentially need is to be told that that proportion of your services are safe and effective. And that's what we're looking for. And fine, in that case, I'll never mention the Chief Social Workers report ever again. I'll just say, here's this fantastic report, and I think it's a thing of wonder and beauty.
As long as it meets the plain English standard, Tony.
Oh, I don't think I'm designed for that, unfortunately.
Okay, Peter.
Yeah, thanks, Chair. Oddly enough, it's the same page, and it's about the complaints handling procedure. And I guess this is a note for Gail as much as anything. At the carers conversation a couple of weeks ago, we were addressing recommendations from the Feeler report, which we felt carers could actually help implement before any legislation was necessary. One of those issues was redress and complaints procedures, and several of us worked on that. All I would like to say, and this is the reason for trying to flag it to Gail, is that I would like to get involved in this, the currently reviewing internal complaints processes, because I think we've got quite a lot to add from a feedback point of view.
Okay.
But I'm not quite sure how to. George and I have talked about this sort of offline casually at times, so I don't quite know how to progress it.
Okay, that's maybe something for Gail to pick up offline with you. Yeah.
Yeah.
Okay. Does anyone have anything else? Or oh, Gillian Galloway's got her hand up. Sorry, Gillian. Spotted you there.
I was just going to say to Peter that I could pick up that offline
Oh,
with him. I'm taking
okay.
the feedback work forward.
Lovely. Thank you. Okay, so if we can go back to the recommendations on page 45, we're noting this report and considering any actions. I think we've got a few actions out of that. I hope, I'm sure Karen has captured. And note and approve the audit recommendations and preliminary management responses. And Tony is going to come back with an edited, finalised version of this report on the back of those conversations. We happy with that? Yeah, everyone? Marvellous, thank you very much. And item 11, just let me get to the page 76. So this is our annual governance statement now, so that'll be over to Sandy.
Thanks, Chair. Just 2 seconds, I'm just going to get there as well. Okay. Okay, yeah, so this is again part of our annual cycle. That's my lunch arriving, fantastic. I'm very lucky.
You are.
I'm very lucky. Yeah, this is part of the annual cycle, and just as a wee aside, I'm actually going to catch up with Chris again. I did have an induction chat with Chris when he joined the board, but I'll maybe catch up with Chris just to talk you through this particular cycle from June to August, because it's a very important part of our year. Builds on the report we've just seen from Tony. This is our annual governance statement, which features in our annual accounts, which is further down the agenda. We have to do one every year. We share this with other parties, NHS Tayside, Angus Council, the other IJBs. It covers a range of issues every year. It really kind of sets out where we feel we are with our governance issues. There's a number of things that we would probably see in here every year, things about describing our governance framework, things that we're maybe looking to develop in for future years. There are 1 or 2 specifics that are in there this year. We've obviously got a reflection of COVID-19 impact on governance. We have mentioned 1 or 2 things regarding mental health governance, and we've reflected back on some adult protection issues that popped up. I think it was at February IJB where they were reported there. So they're things that are particular to this year or this phase of our operations. But the general thing is we have to kind of describe our governance arrangements for the whole year on an annual basis. What we have done is obviously we've relied in terms of summary conclusions on information that we have received from the previous report, and it's all wrapped up together. If we are approving this today, and I hope we feel we can, we will then share this with those parties I mentioned earlier on. There's an extract of this. Part of this report is the kind of covering paper or covering letter we will send to the partners that we're working with. So hopefully, that feels like an okay introduction to the paper. Happy to take any questions.
Okay, anyone have any questions for Sandy on this? No, you're happy with it. I was certainly pleased to see specific mention of the mental health issues. I think you've probably worded it more generously than I might have, but I'm happy to go with that. And it does again highlight the areas where we have less control over when there's a partnership thing, that those are maybe the stickiest for us to have assurance over. Anyone else got anything to contribute on that? Any comments at all? Not seeing any hands, no. Okay, so we're happy to approve the governance statement. We've got 3 recommendations there. Consider and approve it. Authorise me, I guess, as chair, to write to the council, NHS Tayside and the other IJBs, confirming the adequacy and effectiveness of the arrangements, and request that Sandy seeks assurances from our partners around the reliance being placed on systems of control, etc. We all happy with that? Am I seeing very much? Thanks, Sandy. And item 12, which is the unaudited annual accounts. Sandy.
Yeah, thanks, Chair. So again, following the internal audit report, the governance statement, we then see our collated annual accounts. The covering report sets out, the background to the compilation of them, the kind of rules and guidance that we're following with these. The covering report also kind of sets out some of the detail that we show in this set of annual accounts. We have things like the governance statement that we've just looked at, remuneration reports that appear every year, things that people will be familiar with to expect in a set of annual accounts, an income and expenditure statement, set of information about our reserves, balance sheet information. The overall report is at the start of it has a relatively substantial management commentary that kind of describes where we feel we are on a number of issues. Again, it reflects things that are particular to this year, most obviously COVID and how that's affected our arrangements, not just in terms of governance, but also in terms of operations. But the reports also kind of cover a number of statutory requirements in terms of what we have to cover in terms of things like our financial reporting, financial planning, strategic planning. So it's a composite report that brings together lots of things that we will, assuming it can get signed off today, share with our auditors. I think Mary was on the call earlier on. We'll share with our auditors. Our auditors will, I think they're going to review this mainly probably during August because of the scheduling of work. And we will then see a final set of accounts back in September, slightly delayed from normal because of the timelines that we've discussed with Rachel and Mary before. We will get this separately, independently proofread before it goes to the auditors as our unaudited accounts. And it's probably reasonable that I flag up that there are still one or two slightly unusual technical accounting issues being considered at a national level. They won't affect the substance of these accounts, but they will affect some of the numbers in here that we'll have to kind of adjust. You've seen this today here. There's a management accounting report about our financial position this afternoon. The main difference between the numbers in the two is our changes in reserves. And that's kind of well documented in the afternoon. There's lots of funding that's come into the IJB in the last year and the IJBs across Scotland that have increased reserves and they're not really affecting some of our management position, but they absolutely affect our balance sheet and they increase our reserves, and funding will be there for use in future years. Okay.
Yeah. Thank you. Yeah, thank you. I mean, I appreciate the extra commentary around the reserves and I never like to see too much in reserves. I'd rather see it being used to improve patient health or the health of the general population. So hopefully there's a lot of innovation coming forward around some of that. Any questions? David? Sorry, I see your hand up, David.
So, Chair, just to apologise, I'm going to have to leave the meeting at the moment. I need to get to Angus House to sign a deed, which will allow me to get back in time for the IJB.
Okay, thank you.
Thank you.
Take care.
You too.
Thanks. Bless. Gail. Oh, were you waving? You waving at David? Right. Okay. Thought you were seeking my attention. Okay. Does anyone have any question or comment for Sandy on that? Are we happy to approve that paper as recommended? I'm sorry, I'm going to have to swing back to the page. What are we? See what the recommendations.
Chair.
Yeah, I've got it. It's okay. I was just looking up the bookmarks. Okay, so but two recommendations, noting the background regarding the compilation and confirming submission of the unaudited accounts to the external auditors. We're all happy to do that. Yeah, brilliant.
Yeah.
Yeah.
Can I just reply back to you mentioned about the changes in reserves.
Yeah.
We will mention that this afternoon. Mm-hmm. What we're planning to say this afternoon is we might look at ways of getting some of these reserves into circulation and might make a couple of suggestions this afternoon. So again, just linking the reserves note in here. There's always a reserves update in the IJB papers and the finance reports in the afternoon. So we're kind of conscious of that issue about mobilising reserves, and we might make a couple of recommendations in there during the meeting. I think the position moves quite quickly this time of year because we're only just getting sight of the final accounts. And now from one end looking backwards, we're now looking forwards, and we're just at that juncture of, this is where we've got to from the previous year. Now we need to look forward to. So the the kind of working environment on this kind of subject is a wee bit fluid at the moment. So you'll maybe see something pop up this afternoon.
That's good. I look forward to hopefully contributing to that discussion this afternoon then. Are we okay with that? Excellent, thanks Sandy. So now we're going on to item 13 on page 116, which is the internal audit plan, and that's Sandy again.
Yeah, thanks, Chair. As part of our work schedule, at this time of year, we do agree our internal audit plan for the year to come. So earlier on in the agenda, we saw a summary of where we got to with last year's reports and last year's plan. That's where we saw all the ticks, which was effectively that plan getting wrapped up. This is the risk-based, risk-assessed plan that the auditors have put together. And Tony and his team have put this together, but I think we just need to be aware as an IJB board, Tony's team have done it in a certain way, use a set of criteria to develop the plan, and obviously we're just being asked to approve it. I think I would probably want to hand over to Tony now.
Okay, Tony, floor is yours.
Thanks, Andrew and Chair. Yeah, the two key things about this plan is, and both come back to COVID, we normally, we still have gone through your risk register, but we had quite a structured process. And then this is common across all of our clients. COVID has made that more interesting this year. The idea of a 3-year cycle becomes slightly problematic when your assurances from a few years ago don't mean a great deal because things have changed so much. So this is a period of transition, and we'd probably look for a more strategic plan next year, but this year isn't that year. So one, the amount of judgment required was probably more this year. And secondly, we know that things might change. This is a period in which our risk profile changes quite seriously from point to point. So it may be we'll come back later and say, well, that's what we thought at the start of the year, but we know different now and we'll change it. But as it stands, there are some things I think we all need to do. We'll obviously need to do an annual report because we've just done it. There's the integration scheme, which was referred to earlier, and there just needs to be a couple of days in the plan to allow for my time to actually contribute to that. And indeed, we've got the charging report in a moment, and the auditor concerned, to get full value from that needs to work with a group that's going to implement it. So we need just days set aside for that. The key, if you like, discretionary audits are two. One is primary care services, which is obviously a big one for this IJB, and indeed when we talked about hosted services and that sort of thing. But Angus takes the lead on that risk across Tayside. So this is an important report for everyone and part of that kind of wider assurance process. In the same way, for example, I'm doing work on the mental health risk to hopefully provide assurance across the piece for everyone again. So it's an important risk. Forgetting whether it's important across the region, it's very important for yourselves. Mm-hmm. It's such a key issue, and it does tie in with other things, of course, like the workforce. We know the mantra, well, if you haven't got GPs, get an ANP, and if you haven't got an ANP, you need an MP to train, and then you need a nurse to train, and so it becomes quite a complex thing, but you do have a plan for dealing with this. And the important thing is how you as a board understand that risk is being mitigated and that the controls are operating effectively. And very importantly, because it's so key, that the actions that you're saying you're going to take to get the risk down to a healthy and acceptable score are on track, are likely to mitigate the risk in the way intended, and that you as a board get proper assurance over them. So that's going to be the focus of that particular audit, and I think that that's a key one for me. And the commission service providers is something that, you yourselves, it features quite large within your risk factor. And we know that, again, this is one where it's a very complex environment, and one where the risks have changed quite dramatically over the last year. So again, that feels like a very fruitful area to make sure you're getting the assurance, which is, again, similar things. Are the controls working? And should you be in a better place this time next year because of the actions that you're intended to take? So those are the two key ones. So with the caveat that they may change, and a quick pointer towards the incredibly exciting IJB Audit Charter at the background, which I'm sure as audit committee members you've all read and found startlingly exciting. But it does set out the way in which we operate. So I mean, it is actually important, for us as an audit service to have a set of ground rules, for you as an audit committee to understand how we will engage with you and with the client. It just doesn't make for the most exciting reading, if I'm being absolutely honest, but it is important. So you're required to approve that as well as the plan, if you so wish. Certainly any questions you have or amendments you may wish, I'd be happy to discuss.
Thank you. I guess want some comfort around the timescales being feasible for those who are involved in those two audits, particularly. August feels quite soon. How far along is that work? Well, you've gone on mute, Tony.
Right, yeah, I think the truth is we can't start until we've approved the plan, so that is quite tight.
Okay.
I think, yeah, August does feel quite tight now, and that's a very good point. I think, yes, we will sensibly amend that.
Yeah, I think that would be reasonable. I would.
In terms of getting it to the committee as well.
I would rather see a bit more time there for people, because I know what people's workload's like, and I think, your points are well made around the impact of COVID, and I think for the current time period, good enough needs to be our aspiration rather than excellent in some areas. But the work that we've done already has taken us to a good place, a good starting point for that. So I think that's helpful. Does anyone have any questions or comments for Tony on that paper? Sandy?
Yeah, a comment from me, Chair, thanks. I think Tony's covering notes note that we will do that internal audit of primary care services in conjunction with NHS side. We have a kind of a shared risk across the system, and having that shared basis for that audit does mean extra resources will be applied to it, so it'll be as thorough as we can reasonably expect. And this risk is one of the things that we might see pop up this afternoon in terms of your actions that we can maybe to address that in some of our financial planning. Okay, so with an amendment to the timescale there on that particular audit, which is the NO522, we're happy to approve those recommendations and move on to the next paper. Yep, which is 14 external reports, which I think will be a brief one. Sandy? Yeah, thanks, Chair. So over the last 2 or 3 years, we've just brought together a short list of interesting external reports that have been available in the public sector and other avenues in Scotland and the UK, and brought them together and shared them with the audit committee. What we are proposing here, and you guys have had this well trailed, is to shift the way of doing that, to basically shift it into a Microsoft Teams channel, so we can place the reports on that channel, a channel that will be looked after and overseen by our improvement and development team, from our management team. They will put reports in there. We will be able to add chat or comments to those reports, whether that's by the management team or other people looking at them, such as the audit committee members. But importantly, we're also recommending we expand the distribution list, if you like, for this Microsoft Teams channel to the whole of the IJB board membership, so doing a much more comprehensive job. It will allow reports to get into circulation and for comment a lot quicker. We obviously only meet 4 times a year. There's gaps between August and December and things like that. So I think this is us just trying to adopt a new way of doing something. Step change, should be better than what we have. And you know what? If it proved to not work, we can always revert back. We can always sense check that ourselves. But I think this is just a natural step forward for us, and hopefully everybody's happy to go with that. Good. Well, I mean, this is obviously on the back of,
our experience of finding those reports very helpful. And when it's communicated to the entire board, could I ask specifically that there's a link or a direction to how people can find it on Teams, so that it's easy to access? I think not everyone is on the same page in terms of IT capabilities, so that would be great. I would certainly support this paper. Is everyone else okay with that? Any questions? I'm not seeing any hands. Okay, so thank you very much. We'll note the results of this evaluation and support the expansion of this channel. Thank you. And on to item 15, which is the charging for services internal audit report. Sorry, I'm just trying to find who's taking us through that. So that's Sandy.
Okay, thanks, Chair. Okay, so this was another of the internal audits undertaken as part of the last year's audit plan. So again, another of the items that have been ticked off in the reports that we'd seen earlier. Audit committee members may well remember that issues associated with our charging processes have been of concern and uncertainty for us for a couple of years now. They've been mentioned regularly in IJB finance reports. In fact, they come up this afternoon in the finance reports as well. We did agree during the year to redirect internal audit resource to deliver this internal audit piece of work instead. It's very much an advisory piece of work. Grateful to Gordon, who's on the call today, for completing that work. Gordon's provided a summary document, an executive summary, which is what we've got here. He's also provided a much more detailed backup document that's got a lot of technical information in that we can make available to the audit committee separately. What we know is we haven't been able to respond to all the advice that Gordon has given to us, all the technical advice, because it's quite complex and quite deep, and we have quite a big system that we need to work with to deal with that. Everybody from finance people, processing people, care management, systems people. But what we've put there is a set of recommendations as a broad response to this. We need to make sure we understand the recommendations that Gordon's come up with. We need to develop a resource improvement plan with timelines and leadership agreed between ourselves and Angus Council. And then we need to progress that and report back to the audit committee. So that's why the kind of requests, the recommendations to the report are a wee bit high level, because there's a lot of detail behind that. I would say under item 2, there's an item that the recommendation 2B, it says develop a resource improvement plan. And I would hope this, I mean, I'm sure through Gail we would be able to agree resources to support it, but hopefully this audit committee would endorse the resourcing of the improvement plan if we needed to do that. So it was an involved piece of work. I say grateful to Gordon for going into it, and the summary report kind of captures where we are at the moment. I'm happy to take any questions. We've also got obviously Gordon here and Tony as well.
Okay, thank you very much. Does anyone have any questions? Or Tony or Gordon, do you want to come in and make any comment on the back of Sandy's introduction? No.
I'd like to express my gratitude for the Angus Council audit team and Gordon in particular for his work on this. Very, very detailed report, very helpful. And I think what we've done in this aspect of the report is just to put out the main lessons, particularly the one around the kind of the diffusion of responsibility, and just making sure that there's, trying to get one person that's in charge of the thing and thereby held accountable for it, because there was an enormous kind of cast of people involved. And it was quite an education for me, because I had some quite radical solutions, as Sandy's aware, which I don't think would have gone down very well. So I learned a number of things during the course of the audit.
Well, that's good. Thank you. So knowing about the thing allows us to address the thing. So that's Catherine.
I'd just like to also welcome the report. I think it's a really helpful look into quite a technical aspect of the Health and Social Care Partnerships adult service provision, and I think it's come to a place for lots of different reasons that could certainly do with a little bit of refocusing. And I'd also like to just point out that refocusing is probably not just in relation to the adult services aspects that we're considering today. So I don't think this is an issue about system and practice that's specific to health and social care partnership employees and practice. It's a much wider kind of issue than that, but obviously we're only concerned with those aspects here today.
But there's a point in there, Catherine, around how that learning could be shared with other areas beyond this.
I think it's the solution that needs to be jointly manufactured as opposed to learning shared. I think the issue is that the system or systems plural that kind of operate around this area are systems that need to function across more than one aspect of the council's current arrangements. And so the health and social care partnership aspect of it, which we're focused on today, is totally intertwined with the same functions across a range of other council services. So the whole system needs to be part of the improvement journey. So although we're only scrutinising the aspect around adult services here, this is a cross-cutting council issue that will need a number of people to be involved to take it to the next iteration.
Okay, and how does that happen? Is that something you take to the senior leadership team?
Well, no, I wasn't formally a recipient of this report as an operational manager, although I'm aware of it because I sit on this audit committee. And my own service has not been, as far as I'm aware, directly involved in the piece of work. But that would come through the operational management team, through the council's leadership team, and it has done so. So there will be a coordinated approach to the improvement there.
Good, thank you. That's comfort. Okay, thank you very much. No other questions or comments? Oh, Sandy, yep.
Yeah. Thanks, Catherine, for those comments, and you totally agree with all you said there. And just to let you know, just in terms of timelines and everything, we do have a kind of a multidisciplinary charging group within the partnership that links completely within Angus Council. That, to be fair, is mainly looking at adult social care charging issues, Catherine, as I'm sure you can probably imagine. But the people involved are obviously working all different parts of the system, and completely we'll be trying to make sure the improvements spread across the whole of the council functionality in terms of processing of income. And I have been keeping in contact with Ian Lorimer about this, the Director of Finance for Angus Council, and I was just checking my diary. I've got a meeting with him on, I think, the 29th or the 30th of this month to just talk about how we take all this forward. And he has also kind of been bringing together a group to look at before he was looking at bringing together a group already looking at charging issues, and they will continue to look at its output from the internal auditors as well. So we are linking with them to make sure that all happens.
Okay, and just a question from me there, Sandy, on the recommendations at 2D, regular reports to the audit committee. When would the first one happen, do you intend?
Yeah, okay, so we would bring these back as part of the internal audit follow-up reports that we get to every meeting. So the next update you'll get will be at the next audit committee. To be honest, it's probably not going to say very much in August, but you will get a regular update about these points as to where we are with them all. Okay, so if we can move to the recommendations then, note the findings of the report attached at Appendix 1 and the requests allow the team to further review the report, develop a resourced improvement plan, which is obviously critical, progress the agreed improvement plan, and note that these points will be monitored as part of regular reports to this committee. Everyone happy to do that? I'm seeing nods, which is lovely. And I guess the final item on the agenda is the date of the next meeting, which is the 29th of September at 12 noon. Remind me, Sandy, is that 12 noon for a reason, or is it 11:30? Yeah, well, Chair,
mine's gone blank.
We normally have audit committees on the lunchtime before an IJB meeting, but that's not the case in September. So anybody.
That's right.
Yeah, looking for them both. You're not going to get one on the
That's right.
Wednesday
So well
afternoon.
reminded.
So 12 o'clock's okay. Yeah.
That's brilliant. Okay, Gail.
Yeah, yes, remember though that the August date will stand for the risk appetite session.
Yes. Yes. Okay. Right. So we need a reminder of that date then. Karen, does Karen have that?
Chair, I'll pick that up out with the meeting and invite sent out to all once I
That's super.
get the details
Thank
probably
you.
from Sandy and Gail. Okay, thank you.
Thank you. I know I have it in my diary, in my paper diary. It's just a case of finding it. Okay, so thank you very much, everyone, and thank you and congratulations on getting through that significant agenda in such an efficient time scale. I really appreciate that, and I'm sure others do as well. And see you at the IJB this afternoon at 2 o'clock and 34 minutes. Thanks very much. Take care. Bye.
Thank you.
Thanks, Chair. Bye-bye.
Bye.